That was our previous work, actually. So we used wearables, consumer wearables, and we used the Apple Watch to do this, to make predictions with the vitals that it's collected, so heart rate variability, but also step count, to make predictions of the pain score. So when you have a pain score from 0 to 10, and 0 is no pain and 10 is a lot of pain, extreme pain. So we try to make those predictions, and we also believe that in future, hopefully, we could predict those vaso-occlusive crises before the patient is feeling pain. So in the prodromal phase, I think technology can really help clinicians and patients in making this happen, especially vaso-occlusive crises are so unpredictable, and they're triggered by a certain trigger. But if we were able to make those predictions before it happens, then patients could take action, take maybe pain medication or take extra fluids to prevent it. We found that heart rate was a really good predictor of pain, because also in clinics you see that when a patient is in pain, and it can be sickle cell pain but also other kind of pain, then heart rate goes up, and that's an indication for pain. So that's also what we see in our models. We looked at how good our variables were in making predictions and what variables were the best in making those predictions. So heart rate was really important in that, and heart rate variability. Heart rate variability is sort of a marker of stress. So we believe that before a patient is having a vaso-occlusive crisis, the system, we think that the human body is already acting on it. So we believe that there are certain predictors that we could measure that can predict a vaso-occlusive crisis and pain. I think that's the next question for our next research project. So now we want to see if we could correlate the vital signs with the pain scores. So the next step would be, can we correlate the vital signs within the prodromal phase, so it's a couple of hours, days before vaso-occlusive crisis is happening, can we correlate them with that phase to see if we could predict those vaso-occlusive crises? Yeah.